Knee replacement surgery is becoming increasingly common, and if you're watching this video, chances are you or a loved one is considering this procedure. While it may seem daunting, proper preparation can significantly improve your outcomes. It's essential to prepare effectively and navigate potential challenges that may arise along the way. So in this video, we'll cover everything you need to know to get ready for knee replacement surgery to achieve the best possible results. But this isn't just a collection of generic tips you'd find in a pre-surgical packet. Instead, we'll be sharing insights only those with extensive experience in rehab and recovery after total knee replacement can provide. One of the biggest fears people have when facing knee replacement surgery is the unknown. Will the pain be unbearable? Will I lose mobility? Will I be able to return to my normal activities? These questions can create significant stress and anxiety, making it difficult to prepare. These concerns are valid and can be overwhelming, but with proper preparation and knowledge, you can alleviate some of the uncertainty. Tip number 1, maximize pain management. Pain is an unfortunate part of the recovery process, especially after a total knee replacement surgery, and it's basically unavoidable. However, there are plenty of effective ways to manage pain that don't rely solely on medications. While I strongly recommend following your doctor's advice regarding medication, you can also supplement your pain management with some non-medication based strategies that provide additional relief. Trust me, you want to manage your pain. Research shows that those who effectively control their pain tend to have faster and better recovery outcomes. This is because they can stick to their rehab exercises and feel more willing to move around. So don't approach the surgery with the mindset that you need to tough it out. Effective ways to manage pain include consistently elevating your legs and consistently moving your knee. And while your knee will be sore and movement will be uncomfortable, you don't want to get stiff. Movement helps pump out the swelling, making movement more fluid and resulting in less pressure in the knee. And once the incision heals, investing in a quality compression sleeve can be really helpful for reducing swelling. Check out some highly effective pain management tools in the description below. I especially recommend investing in a cryo wrap, or if you want to take icing to the next level, consider a cryo ice machine. These options make icing easier and more consistent, providing more thorough cooling for better relief. Tip number 2, strengthen your quadriceps. Research shows that many people with knee arthritis have significant quadriceps weakness before surgery, making activities like going up and down stairs quite challenging. It's important to understand that arthritis isn't just about joint pain. It can also lead to deconditioning of the muscles around the knee. The quadriceps are crucial for stabilizing your knee joint, and when you're weak, moving around becomes harder, putting more strain on your joint. Unfortunately, a knee replacement won't automatically fix the muscle weakness. In fact, it can actually worsen after surgery. This means that you not only go into surgery with weakness, but you'll come out even weaker. So it's a good idea to focus on strengthening exercises for your quadriceps muscle before surgery. The better condition your muscles are going in, the less muscle loss you'll experience, which sets you up for a smoother recovery and greater success overall. One of the key tools I utilize in the clinic with all of my post-op total knee replacement patients is something called the neuromuscular electrical stimulation unit. This device is designed to help stimulate the muscles around the knee, which is particularly important after surgery when muscle weakness can be a major concern. NMES works by sending gentle electrical impulses to the muscles, causing them to contract and helping to maintain muscle tone. This is crucial because after surgery, many patients find it difficult to engage their muscles effectively due to pain, swelling, or simply being less active. By using an NMES device, you enhance activation of these muscles, helping to combat muscle atrophy and improve overall strength after surgery. So hopefully, your therapist will be using an NMES device with you. But if they aren't, don't hesitate to ask about it. And if you want to achieve the best results, I recommend getting one for home use. Check out the link in the description below for an easy-to-use NMES device that can support your recovery. Tip number 3, refine your diet. This is something that goes overlooked, but it can be crucial for your recovery. During the early phases after surgery, you're likely going to be moving much less than you did before, which means you'll be burning fewer calories. As a result, there's a good chance you might gain some weight, and that's the last thing you want during your recovery. More weight means more strain through your knee. But don't worry, you don't need to jump into some crazy fad diet. Simple adjustments to your diet can make the big difference. Start by eliminating processed foods like soda, junk food, and fast food, and replace them with healthier options. It doesn't have to be a drastic change, even small improvements can have a significant impact. By reducing those empty calories, you'll not only help prevent unwanted weight gain, but you'll also create a better healing environment. After a total knee replacement, which is quite an intensive surgery that leads to a lot of soft tissue and bony injury, a good healing environment is essential. The better you nourish your body, the faster and more effective you'll heal. So focus on making those healthier choices. Every little bit helps. Tip number 4, enhance your sleep. Sleep is something you're likely to struggle with after surgery. Finding a comfortable position can feel nearly impossible, and even when you do find one, it often doesn't last very long. While sleep quality will improve over time as you recover, it's essential to seize every opportunity to get some rest during the earlier phases of rehab. Sleep is crucial for healing, and perhaps even more importantly, for your sanity. To enhance your sleep quality, focus on managing swelling before bedtime. Elevate your legs for about 30 minutes before you sleep, ensuring they're positioned above your heart. This helps reduce swelling and prepares your body for rest. After elevating your legs, get into the habit of doing some light knee exercises to help pump out any excessive fluid and alleviate any stiffness. Also, time your medications as your doctor recommends before bedtime, as this can help you fall asleep and stay asleep throughout the night. A helpful tip is to use a pillow between your thighs. People report waking up in the middle of the night due to pain when their knees touch, and the pillow between the knees can keep pressure off your surgical knee, reducing discomfort and preventing disruptions in your sleep. While you're not going to be sleeping like a baby, you might be able to steal a few more hours of sleep, which can make all the difference. Another really cool option is a hip abductor pillow. This is a pillow that goes between your knees and has a little strap to keep it from falling off. I included a link in the description below for the hip abductor pillow if you're interested. If you have any questions or experiences you'd like to share, please leave them in the comments below. Don't forget to support the channel by hitting that like button and subscribe to the channel so you can stay up to date on everything you need to know about your body, how it works, and what it needs to keep moving.